distinguished guests, friends, colleagues from across Asia Pacific regions that join us here in the 56th Asia Pacific Academic Consortium for Public Health Conference in beautiful Chiang Rai, Thailand. I'm Dr. Sutantri and I will be the chair for this panel session. I'm a lecturer and also a researcher, and my background is a nurse actually. And I work in Universitas Muhammadiyah Yogyakarta. It's a private university in Yogyakarta, Indonesia. So it is truly an honor for me to serve as the chair for this workshop. As you can see, the title of our workshop is Strengthening Breastfeeding System, Supporting Mothers from Hospital to Community. So this session, as you can see, is jointly organized by LactaHub. LactaHub is a global platform dedicated to advancing breastfeeding knowledge, research, and professional collaboration in collaboration with APAC 2025. So please join me to thanking LactaHub and APAC for making today's session possible and also for their unwavering commitment into empowering family across our nation. Okay, so before we start, I invite you all to imagine or to take a moment to think of one mother. It can be someone you care for, somebody you work with, or maybe your own family that face challenge while they're breastfeeding. So I think there are many of us actually. For a woman, oh yeah, there are more people coming, yeah, please. I think you can open the door, leave the door open. Yeah. Okay, let's start, yeah, because we just thinking of one woman before. Okay, I start again. So let's think one woman that you care for, you work with, or somebody that maybe your own family that they face challenge while breastfeeding. I think there are many of us, and many of us also struggle in silence sometimes. They don't know where they can search for support. They don't know what to do. And sometimes even the family itself, the closest, the support that they can get, also not really supportive at all. So our today's goal actually to make her journey easier. The woman feels supported, feel confident, and can work from hospital to home. So this workshop is actually not only about policies, about data, but we also want to think more about compassion, about collaboration, and also commitment. Today, we have three remarkable speakers. I will show here in the slides. So this is our workshop today. We have three remarkable speakers that are going to speak in this session. So each bringing unique perspective. One, Dr. Aria Taidarto. She is a pediatrician, breastfeeding counselor. And then the second one, Dr. Verika Inarwati. She's a nurse. She will talk from nursing perspective. And the third one is Dr. Sarayor. She is the pediatric cardiologist as well, and also from a breastfeeding expert. And each speaker will talk for 20 minutes, and then after that it will be followed by a plenary Q&A, so we can share your thought, discussion, feedback, or maybe an experience about the breastfeeding, or when you help the woman that dealing with the breastfeeding challenge. Okay, without further ado, we would like to invite actually our first speakers. She is a passionate pediatrician and breastfeeding counselor, advocate who leads both science with science and heart. Yeah. So please welcome Dr. Arita Hidarto to join me here in front. She is a breastfeeding counselor and she also the vice head of medicine study program at Universitas Ciputra Surabaya, Indonesia. She also leads the research division of the Indonesian Breastfeeding Counselor Association and serves on the Indonesian Association of Child and Adolescent Mental Health. So today she will speak on the topic of this one. The role of trained counselors in advancing breastfeeding in Indonesia. So Dr. Arita, 20 minutes, the floor is yours.
Thank you.
Thank you, Dr. Tantri. Very good afternoon, everyone. Thank you for occupying the seats this afternoon. This is truly an honor and privilege for me. Thank you, LactaHub, thank you, Kai, and my fellow speaker. So let me just test this for a minute, if it's working. Okay, so I'm here, although I think you've heard that I represent many hats, but today I am representing the association. I'm representing the Indonesian Breastfeeding Counselors Association. It stands for IGMI in short. It's Ikatan Konsulat Menyusui Indonesia. We are among the first in Indonesia. So, have you ever been to Indonesia? Are you Indonesian? Oh, Indonesian, still Indonesian. Okay, so if you've never been to Indonesia, Indonesia is an archipelago country. We have so many islands. We consist of roughly 38 provinces. I think it's growing. And now, by June 2025, we have in total 286 billion people in population, and almost 50% of our populations are female. So imagine. And I would like to take you to how disparities and gap in breastfeeding in Indonesia nowadays. We did have a setback before. We have not been able to reach 50% of exclusive breastfeeding in Indonesia. However, we managed to thrive to 60% in 2024. However, if we receive data, we need to look carefully whether the data is meaningful and accurate, right? So nowadays, we still see so many babies and infants who are not exclusively breastfed in Indonesia, and this is still a very challenging phases for all of us in Indonesia. So why do we need counselors? Why do we need counselors? Well, there are several factors why mothers perform early weaning that can be internal or external, but mostly if we take a look at here, the barriers, if you see, mostly is society related, personal related, or community related, because mothers, there's no manual to become a mother, whether it's a firstborn, secondborn, it's always a new experience of being a mother. So if you face a mother with lack of knowledge or social pressure, not to mention cultural pressure, which can be, vary from one culture to another, then what they need is support. Even one single word of supportive phrases can change a mother's life, meaning can change the decision that she makes for her children. That's why we need counselors to be a friend, to be a sister, to be family, and to be the strongest support system for mothers. Therefore, we did have 13 people who were so passionate about breastfeeding. They located in Jakarta. So initially, it was granted in the law when it stated that every child has the right to receive exclusive breastfeeding. So initially, everybody who are passionate basically care for this topic or issues or situation, come forward, and then with different background, not to mention they are from economics, law, so not necessarily healthcare professionals or professionals in healthcare. They come together and then they take part in delivering IGMI, the Indonesian Breastfeeding Counselor Association. So the pioneering founders, we have 13 breastfeeding counselors, so they are very diverse. We even have housewives, so they don't work, so they are very passionate about this. It first we established 6th of August 2011 in South Tangerang. Jakarta is the capital city of Indonesia. It is located in Java Island. So our ongoing mission is to have a very strong, solid foundation of support system. Because everybody can learn about breastfeeding, everybody can read about breastfeeding, everybody can try to understand how breastfeeding works, but not everyone who will willing to walk through the journey with the mother. So, if you've never been to Indonesia, this is one of the islands. It's called Java Island. Yes, we do have sharks, so beware. We have sharks. We have several regions. So the first, ICMI was the headquarters in 2011, and then it expanded in 2020. The first will be in East Java, where I come from. East Java, this is the population for each region or province. So these are the reason why. So after the pandemic, we grow. So pandemic COVID-19 did not hinder our spirit. It is more to inspire us to do more and to do better. So this is currently our situations. We have 642 counselors across the nation. And as you can see, the highest tip for the increment is in 2024. We have an additional of 273 counselors extending from Aceh to Papua. We have to admit that the eastern part, that means nearing Papua, we do not have enough breastfeeding counselors. So in our strategic plan, we are going towards eastern part of Indonesia, because when we talk about regions, we talk about culture and how to approach a personal matter would be better if we understand and we are more culture sensitive. So this is my boss. He conveyed his remarks that he cannot be here today. So this is Dr. Ronnie. He's the head of the ICMI, and this is the head of all of the branches that we have so far. Yes, it is still concentrated in Java Island. So why do we need trained counselors for? Why not just counselors? We need trained one because it can bridge between health facilities and the communities. All mothers, families, babies are from communities, and they have this transit point in health facilities when they were born and when they have their deliveries. And after that, they need to go back to the communities, right? So this cycle cannot be broken if we do not have a common solid understanding and perception on how we can have the breastfeeding period sustained. Therefore, this breastfeeding counselor will accompany the mother before, during, and after until they don't need a friend anymore, right? So we provide one-on-one counseling group, or if they feel like it's more comfortable to have a company, we also provide group education, or with spouses, with the husband or with the father of the child. And what we do, we address myths. Sometimes what people say matter more than what doctors say or what your friends say, right? So even the social media matters more right now. Even we keep saying it's not true, but seeing all of those breast milk stats, it can be very, very intimidating for mothers. So what we want to aim is to improve exclusive breastfeeding outcomes and also a very sustainable one. So that's why by this year, the cycle, the continuum of care commonly comes from pregnancy period, delivery, postpartum, and community. But it may now aim for adolescents because we think, why not start early? Because all adolescents will become father, well, not all of them, but they will become a part of your family, part of society. So why not start early in delivering this education? So we have educated, I think approximately all over Indonesia, more than 30 schools, 30 high schools in Java Islands alone. In our celebration of World Breastfeeding Week this year, so 2025, we educate adolescents, girls and boys in high school so that we have an early start. Now, this is why I'm here today, because I would like to share with you how we come up with a platform that can reach mothers and families beyond physical limitations or physical boundaries. So we develop COMIC. COMIC stands for Counseling Menyusui, Counseling Online Menyusui. So it's an online counseling breastfeeding counseling. So we use a platform of Zoom or WhatsApp group. So the birth of the comic was when the COVID-19 hit us, because we feel like if we felt so alone during pandemic, what about mothers with their babies? So we would like to become their friends. We would like to become just someone to talk to during this trying time. And we promise them no judgment. And later on, I will share with you how we can assure all of our clients that we are still providing in compliance to the counseling principle, because it's not easy when you're doing it online. So up until I think this year, we have around 70 mothers using our platform, plus. They're from housewives, civil servants, even health professionals, doctors, pharmacists, midwives. They use our platform, and students. Yes, we do have mothers, teenage mothers, and they use our platform to seek more accurate information. We have 18 provinces and 2 international, so we had clients from Japan and Germany. They were basically Indonesian, but at trying times, you want to feel familiar, right? So they need an Indonesian breastfeeding counselor to accompany them throughout the journey. Now, can I play this? This is how a client can register to this platform. This is a very short video. I will translate it later on or in between. No sound. So anyone can access this through our website and our social media on how to have them register in this platform. So we give them definition, what is comic, and who are involved in it. We give them the names of the counselors. They can choose the name of the counselor that they feel comfortable to talk to. And all of the breastfeeding counselors are trained and supervised initially, whether or not they are capable of giving counseling through an online platform, because it's truly different when you're doing it on site. So this is how to make order. We have social media and also we have website, and each of the branch also have their own social media account. So we hope that we are accessible at all times. And once they got through to our administrator, they will fill in the form of assessment so that our counselor can have an initial background and knowledge about the client themselves, so it'll be easier for them to assist. Basically, we use Zoom platform, but sometimes we also use video calls for areas that perhaps have a challenging connection. And after they finish with the counseling, they can make another appointment, and before they leave the session, we will ask them to give us feedback. So these are the counselors that we have, approximately 26 to 30 counselors. They are trained and they are assessed periodically to ensure that they still can deliver and in compliance with the breastfeeding counseling principle. This is Ibu Mika. Ibu Mika is the coordinator for counseling. And this is the snapshot on how it went. Picture shared with consent. So they are happy to share it with you today because they are happy clients. So what mothers say about comic? Well, in average, they are very satisfied. But when we talk to them personally, what they most feel satisfied about is that they have a friend who's willing to listen without judgment. We provide a very safe um, room to share. And even though it's through online, the connection is incredible. Perhaps because they feel alone and then be willing to listen. Because sometimes even in on-site counseling session, if you believe in chemistry, it is something that you cannot make up, right? But moreover, doing it online, however, they feel like we were there genuinely to help. So this is one of the feedback that we have, mostly about connectivity because some of them come from very remote areas. One of the challenges would be the situation, the background situation, because not sometimes in different condition we would like to assess the breast condition to help mothers breastfeed their babies better. So we need to ensure that their privacy is still maintained. This is something that we are still working on about safety and security of data. So as the organization, as the association, we work together alongside with the Ministry of Health. So this comic program launched at the same time when our Ministry of Health of Indonesia also launched a similar program, and it was for free. But we would wish that we can collaborate together, but we are still in work in progress for that. We also work with several training providers for companies, for factory, for schools, for universities or academic institutions. We provide breastfeeding counselor training. And now, since we believe that a learned counselor is better, we now provide a coaching session for all of our breastfeeding counselors for them to be certified as lactation consultant. So nowadays, not even me, we don't have the time yet. So I think around 30% of our breastfeeding counselors are now breastfeeding consultant, certified with IBCLC. So the cons of this would be an unequal distribution of counselors, and also we cannot say that this is a 9-to-5 jobs. We still work on how to make this a legal and financially committed platform. We are still working on it, but in the future, we hope that all of our counselors are in line with all of the policy implemented in the country. Now, visions forward, we would want that our clients to have their privacy and data protected because it's an online session, and having a structured follow-up will help a consistency post-counseling. So this is not a one-time thing, but one continuous cycle. And of course, in this technology-based era, we would want that our system would be run by professional and tech-based system. So I'm there. Our take-home message is that communities has a heart of change. We cannot take one mother out of its communities. We are also part of a community. And instead of condemning what happened in the community, we need to embrace and also co-create the environment that we want for the children, the mother, and the whole community to support the growth of the child. And most importantly, when community leads, nation advances. So we prioritize people over system. Yes, systems are important, but if we do not involve people in it, then it will be baseless because what matters most are the people. So we hope that our archipelago nations can take this and then unite professionals and volunteers to work together because we believe that we have the same passion, we care for the people, for mothers, and also for the children. So we believe that being rooted in culture, we reach across island, we bring knowledge, friendship, and presence to every mother, every child, everywhere. Thank you. From Dr. Anita's presentation, actually, there's one thing of the role of trained counselor, actually not only providing information, but what more importantly is how they provide encouragement to the mother. They become like the creating connection as well, and also offering empathy. So that's three most important role actually for the trained counselor. So yeah, empathy, connection, and encouragement. Three
most important part from the counselor. And as we can see as well in Indonesia, and maybe later on during the Q&A, you can share the experience maybe from your country as well. Already started or initiated like the online counseling for the mother actually that started during a pandemic, and actually it got really received really nice review, and people need more actually in the future because it's offer like flexibility actually. They don't need to go to a specific place to get the counseling, but they can do it from home. I think that's also offering kind of like really flexibilities. And what really captured my attention as well, actually, the Dr. Arita Tekome said that she said communities are the heart of change. I think that's also really important message that this is like a powerful example of people power system. So how we can create a change that starting from the community, from the grassroots. So thank you very much, Dr. Arita, for your really excellent presentation. So we're gonna move on to the next presentation. So we move from trained counselor actually to the next part. We're gonna see it from the nursing perspective. So we already have our second speaker, which is Dr. Ferika Indarwati. She is a lecturer and also a researcher in pediatric nursing. She's also the head of School of Nursing in Universitas Muhammadiyah Yogyakarta. So it's the same institution actually as mine. And today she's gonna talk on the first 1,000 days exclusive breastfeeding and integrated child health monitoring in nursing practice. Because nurses everywhere, I think worldwide, is the largest workforce everywhere. But sometimes their role is kind of still undermined. So now Dr. Ferika will offer specifically how nurses can make change and also can contribute in this breastfeeding sector. So please, Dr. Ferika Indarwati, the floor is yours.
Okay, everyone, please let me introduce my name. My name is Ferika Indarwati, and as previously mentioned by Dr. Tasudandri, that I'm from the University of Muhammadiyah Yogyakarta, and I'm a nurse. Here I would like to share a little bit of my experience as a nurse as well as a clinical instructor in the hospital, where we have 5 hospitals in our study program. So 3 is the government hospital and the other 2 is our own private hospitals. So today I would like to talk about these 4 main topics. So the first one is about the first 1,000 days of life, and the second one is the current EBF status in Indonesia, but I don't think I will repeat this one again because I think Dr. Arita already explained it before about the achievement of exclusive breastfeeding in Indonesia. And the third is about the nurse roles in EBF support during the first 1,000 days of life. And the last one is about the integrated child health monitoring. Right. So I think all of us here is a health professional, isn't it? Any one of you a midwife? Yeah, sure. I think I saw from. Are you from Makassar or no? It's from Indonesia. No. Okay. Yes. Is it from Sumatera, Medan? All right. So, okay, we have a midwife here. Do we have a physicians here? Okay. Prof. Dari mana, Prof? Makassar. Okay. Mohon maaf namanya. Oh, okay. Oh, this is one of the seniors. I think I knew your name. In University of Queensland, isn't it?
Oh, in Queensland.
Yeah. Okay, nice to see you, bro. And do we have a nurse here? It's only me. And public health professionals. Do we have a public health professionals here? Kesehatan masyarakat, public health professionals. Oh, we have here. And we also have pediatricians here. 2 of our speakers is pediatricians here. And we actually have outside oncology surgeons here. Okay. So the first 1,000 days is not really new terms in our health professions. It's from conception to a child's second birthday. and it represents a critical windows where they have rapid psychological growth and significant brain development. That's why in this vulnerable period, the nutrition is very important. Adequate nutrition during this time is for preventing stunting, especially, as well as ensuring optimal brain development. And here, we understand that lack of proper nutrition during this time can lead into long-term effect and child health as well as cognitive abilities. Okay, this picture, I took this one from Beluska and Turkan. This is a research that has been done by the nutritionists that they studied about the importance of the first 1,000 days of nutrition effect on the child development. Here, he explained about the effect of the proper nutrition into the central nervous system as well as the growth of the brain from the newborn up until 2 years. With the proper nutrition, we also find that the heart of and development of the children will be able to achieve the optimum growth. And now this one, I think previously Dr. Areta already explained about the achievement of the exclusive breastfeeding in Indonesia, and it actually not that bad. We reached around 66.4% in 2024, but we understand that it's still far to go to achieve the 80% of the national target. So that's why as a health professionals, it's our calling to improve our roles, also to achieve the target of national breastfeeding in Indonesia. Now, I think this one also have to be understand by all of the health professionals that the importance of breastfeeding itself that also previously been explained by Dr. Areta that we understand that this breastfeeding is the cornerstone of the maternal and child health. It can prevent malnutrition, neonatal and infant death, also incidence of breast cancer as well as to prevent economic loss of the nations. That's why in our national program, breastfeeding is still the top main priority from our government. The barrier and challenges. So in my presentation, I divided the barriers and challenges that we face into 3 categories. The first one is the biological one, the second one is the psychological one, and the last one is the social or cultural thing. That's the main thing that we're facing as a nurse when we help mothers to be able to achieve the exclusive breastfeeding. And I think this one, the 10 steps of strategies to successful breastfeeding by WHO or UNICEF. We already have this one in our platform here. And sorry, am I turning off? Oh, yeah. Okay. Yeah, this one mainly as a nurse, we also implement these strategies in our practice. Now, deep into the detail of the nurse roles here, we first understand that exclusive breastfeeding is the main important one, our target that we need to achieve. That's why we have to strengthen the roles, especially a nurse as the front line of healthcare workers here. But we also understand that supporting mothers will not only be able to be done by a nurse, but we also have to collaborate with others, such as with midwife, as well as with the physician or pediatrician to achieve our goals. And here we divided from the national strategies. We have sensitive and also specific strategies. Okay, this one, the specific one is targeted into the mother and children itself. For example, we have like the education and counseling of the exclusive breastfeeding. We also have education for the complementary food and vitamin and supplement for the children as well as for the mothers. For the sensitive strategies, we apply this one. It's not only related directly to the mothers or the vulnerable group that we want to target, but here we work outside, outside the health sector, for example, providing access to clean water, sanitation, and poverty alleviation program, and etc. Here, that the main point for the sensitive strategies is to support our specific strategies. And this one, I've done like a little bit of research as well as a summary of the roles of nurses here, is spanning not only from the prenatal but up until the postnatal, as well as we also do the collaboration and also advocation for supporting mothers and their children. Right, this one is we found as the best strategies that we implement in our practice. The first one is about the antenatal and postnatal education. We found that structured education that we did in the community as well as in the hospital, with the intense follow-up can improve maternal confidence and exclusive breastfeeding rates. Also with the peer counseling, like Dr. Areta said, we have like a trained breastfeeding consultant. Also we have the trained peer supporters, which is from mothers to mothers. We found also very successful to improve the exclusive breastfeeding rates. And the third one is about the online resources. Like also in connection with the previous presentation by Dr. Areta, we also use this one, online resources and LactaHub. It's internet-based support and mobile messaging enhance knowledge of the mothers as well as the family. Family-oriented program, we understand like breastfeeding is actually not only the job of mothers. Mothers need support from their family. In Indonesia, the problem is that sometimes the grandmother or the father it really have a big influence on the decisions of mother whether to breastfeed their babies or not. That's why we have to create this family-oriented program to involve them on the care of the mother as well as the children. And here we also enforce the multi-level intervention, combining education, peer supports, and family engagement. This is the most effective program that we can do as a nurse, as well as, like for example, as a midwife, to overcome the exclusive breastfeeding barriers. Right now, except supporting mothers, especially for the breastfeeding or implementing the breastfeeding programs, we also have to support that strategies with the integrated child health monitoring program. So it's not mainly about the mothers itself, but we also care about the children or the babies. So we can here understand why this is important, because this based on the framework or theoretical models that a baby or the child groups needs following or follow up monitoring here. So this the framework that we can use, especially in Indonesia, we implemented this one, the specific EMCI, the Integrated Management of Childhood Illnesses, or we call it like MTBS. But we also have the one in the hospital as well, that also we implemented along with the hospital initiative, baby-friendly hospital. And the best practice is that if we implement the EMCI here with the structured implementation as well as the integrated collaboration as well as continuous professional development, it will be like successfully provide support for the breastfeeding mothers. Right. Okay. We combine the supporting exclusive breastfeeding and health monitoring for the mothers here. We as a nurse use or have the direct nursing intervention here, implementing the direct nursing intervention. First is doing the antenatal or postnatal education, as well as implementing this one baby-friendly hospital initiative. That most of the hospital, especially in my university's hospital, we have two hospital, PKU hospital already implement this framework. And we also do the growth monitoring and home visits, where we also have collaboration with Puskesmas or community health centers to do this. And with combining this one as well as the community and family engagement with peer support groups and family involvement and also community mobilization, we can provide excellent health service to support mothers and their children during the first 1,000 days of their life. Right. We understand that at this current time, we will not be able to stay away from the improvement or advancement of technology. In doing the supporting program for our breastfeeding mothers, we also use the technology here. We have like a kind of mHealth and digital platform. mHealth actually not really that sophisticated in Indonesia because it's mainly for the documentation. Administrative one now. But we hope with the advancement of the research we can do more about it. And mass media campaigns. We have like so many platform here that built by the Ministry of Health. They have like kind of poster flyers as well as some information in their website. But sometimes the one that we need to improve is that the access to the website. Because sometimes it's very hard to find for the cadres, the community health workers, to find that resources because they're not really customized to search on that resources. That's why we need to train them to get the file resources so they can it can help them to do the counseling as well as to do the health education for mothers. And now we also have okay. We have the community engagement program as well. So like I said before, like peers program where mothers also can teach the other mothers. So they really learn from each other. It's not only us as a health professional that are doing the health education for them, but they also can learn. And we find this one is very effective because they can share each other about their experience. And I think this one is from the last. Oh, sorry. Yes, this one. How to make it bigger? No? Okay. So the innovative intervention that blend digital and traditional approaches is really, in our opinion and our study, it's really effective. Can improve the rates of the breastfeeding in Indonesia. Okay, however, we understand that all of the studies always come with the barrier and challenges. As I mentioned before, the cultural terror intervention of studies is still needed because we in Indonesia we have so many provinces and all of them like have different ethnicities. So we have to have, even though like for example I live in Java Island, it will be very different in Medan or Sumatra Island. The approach that we use to teach or to do the health education will need to be tailored so it will match with the culture perspective of the people there. As well as we have to have standards intervention monitoring our protocol here. As well we have to also consider the socio-economic situation. We understand that sometimes the working mothers, we found that most of the ones that not be able do the exclusive breastfeeding is the working mothers, because of the socio-economic pressure, they have to go to work and they choose to give their children the formula. And lack of family support as well, okay, because of the pressure from the grandmother, for example. If in Indonesia, if we leave our children crying because maybe we still have difficulties in producing breast milk, then the grandmother usually say, just give the formula. It's also the pressure from the family that makes the mother decide to not continue breastfeeding. And synergistic among intervention, integrated child health monitoring NDF breastfeeding program is also important to improve the breastfeeding needs in Indonesia. Okay, to conclude my presentation today, we all understand that breastfeeding is important, especially in the first 1,000 days of the child's life, because the proper nutrition, appropriate nutrition will ensure their growth and development. Here, as a nurse, we have to be really collaborative with other health professionals to achieve the national target of breastfeeding 80% in 2020, in 2030, I think, or 28, isn't it? 9, yeah. Okay, and the future direction is to blend digital technologies in our service or programs, because we will, like I said before, we really need to reach as far as we can to improve the breastfeeding rates in Indonesia. Okay, I think that one and the cultural sensitive intervention is also important to achieve our target. I think that one for my presentation. Thank you for listening.
Okay, thank you very much, Dr. Verika Indarwati, for your inspiring presentation about the role of nurses in guiding actually the families as well for achieving exclusive breastfeeding. So, as we can see, actually, as nurses, it's not only their role is not only as a caregivers, but actually as a connectors. They guiding the families, they do the follow up, they do community engagement. So the families and the women feel supported, because actually from the first speaker we already highlight the biggest challenge sometimes come from the families itself, the grandmothers. Sometimes like, okay, just give the like formula instead of the breast milk, because the breast milk is not there yet or something like that. But the biggest support also can come from the families. So actually families can play either way. It's like flipping coin. In one side can be the biggest challenge, but on the other side can be the biggest support as well. So that's the nurse can play part in that, in guiding the families as well, providing encouraging support, so the family can strengthen the care and also to improve like the breastfeeding rate as well. As Indonesia want to achieve 80%, yeah. It's much higher actually, the target. That's the WHO only wants to aim for 50% in 2025, and Indonesia you want higher than 80%. That's wonderful word. So okay, so we move on to the next speaker. So after Indonesia, so we move from Indonesia, now we're gonna fly to our host country, Thailand. So here come join us Dr. Sarayorn Tominitras. Let's give her a warm applause. She is a pediatric cardiologist, and she is also a lecturer from Faculty of Medicine in Sulaborn Royal Academy. And today she will talk about the Thailand's integrated public health strategy for breastfeeding intervention. So after we talk about counselors, we talk about nursing, and now we move on to talk about the policy. Hopefully it will complete the whole story of our workshop today. So okay, Dr. Sarayorn, for the next 20 minutes, the floor is yours.
Hello, good morning, good afternoon in Thailand. Today, I would like to introduce myself first. I'm Dr. Sarayorn Tominitras. I'm a pediatric cardiologist from Thailand here, and it's truly an honor for me to join everybody here in the conference. Many people ask me, I'm a pediatric cardiologist, why I'm interested in breastfeeding. My interest breastfeeding began 15 years ago when I had my first child. Actually, I have only one child. When I had my first child, the knowledge that I gained from medical school, from pediatric residency training, I realized that it's not enough. When I have my own problem with the breastfeeding, there were only a handful of the experts who helped me in that situation. So luckily, I can accomplish 1,000 days of breastfeeding. But at that time, it's a very challenging for me. So I have a commitment to improve breastfeeding care in the facility that I can. I teach medical students, and in my own practice in the hospital, I support breastfeeding because of this. So today, before I begin, I would like to note that this presentation reflects my personal experiences and perspective. It's not a policy statement. And my participation here, I got kindly support from the Family Locenquist Foundation. And two persons that I would like to acknowledge before I start is first one, Dr. Achala. She's a former Director General of the Department of Health. And the other one is a neonatologist, Professor Dr. Sakji. He is one of the great role model for breastfeeding support for sick baby in Thailand. So I draw the valuable insight from both of them for the presentation today. Today, I'm going to talk about three topics. One is the situation here in Thailand, the policy, the implementation we have done so far in Thailand, and the challenges and the future direction. In my own opinion, that what's going to be to success in breastfeeding. And now, look here in Thailand, we'd like to give you some more information about our demographic data. We have around 66 million people here, but for the 4 consecutive years, our birth rate is less than death rate in Thailand right now. So we're turning into the aging society. So this demographic change, we have an urgency to support every single birth the best we can. So I think breastfeeding is one of the beginning of the journey to support our children. So everybody know that breastfeeding can contribute to many of the UN development sustainable global development goals. So, but only 29%. I'm very impressed with the Indonesian data that they almost 80% right now. But here, only 29% of Thai babies had exclusively breastfeeding at 6 months, and which is the lowest rate in Southeast Asia. Maybe some our audience come from this country, and we are as the baseline of everyone. Although our Ministry of Public Health have the policy to support breastfeeding for 3 decades, you can see that the rate of exclusively breastfeeding for 6 months also rising. But right now, the current information found that we're still far from the global and national target of 50% of the UNICEF. And breastfeeding is a foundation of life. We know that initiation of breastfeeding within 1 hour can promote bonding and promote sustainable breastfeeding, but only 29% of our kids receive the initial breastfeeding within the first hour. When we look into the data landscape of breastfeeding, you can see that almost every kid ever breastfed, 97%, and 3 out of 4 kids got the early initiation of breastfeeding within 1 day. This information tells us that the awareness or the intention to give the breastfeeding of the mother is not the problem here, but the problem is that the rate of exclusively breastfeeding at 6 months
got the sleepy drop down. It might be the supporting system, the barrier that mother faced, and we lack of this supporting system to help them to continue breastfeeding up until 6 months. So this is the data from the study in Thailand. They found that the most three common reasons why the mother cannot continue the breastfeeding at 6 months is that first of all, they're concerned about the adequacy of their milk supply, and they're concerned about the quality of the milk. If their babies have less weight or lower border of the at the growth curve, many mothers concerned whether it's the cause of the milk. And the third one is that they need to return to work. So many mothers discontinue breastfeeding before 6 months. Our national policy framework also follow the 3 pillars: promote, protect, support breastfeeding. We do have the healthcare standard, but let me tell you more about this. We used to have the baby-friendly initiative. However, the formal baby-friendly assessment, we discontinued it for nearly 20 years, interestingly. And right now, the Department of Health have a regulation for mother and child health standard for healthcare facility. But this one, focusing more on the theoretical knowledge rather than the skill of the healthcare professional. But luckily, I have seen that the Department of Health nowadays, they are now reviving the baby-friendly hospital initiative one more, and hope they're going to implement this again soon, in maybe this or next year. And one foundation that I would like to mention, in Thailand we also have the private, it's not government foundation. This foundation established since around 20 or 30 years ago with a group of physicians, nurses, nutritionists, lawyers, and public communicators who aim to promote breastfeeding in Thailand. So this Thai Breastfeeding Foundation work closely with the Ministry of Public Health to promote breastfeeding. And also for the sick baby. Now we have developed the SPAS model which support the sick baby in the NICU because no one left behind. So we also have the program to support the sick baby to be able to get breast milk as well. For the postpartum support, we can see that the critical window after for the breastfeeding is first 2 weeks. So we have the breastfeeding clinic where after delivery, mother can come and get support from the breastfeeding clinic. Most of the tertiary care level in hospitals in Thailand do have the breastfeeding clinic, but not in every district. But in the province level, we do have breastfeeding clinic in almost every provinces. After discharge, nowadays 100% of our mother delivery the baby within the hospital, and usually mainly under the cover of obstetrician. So after they discharge from the hospital, they move back to their village. We have the system to transfer the information from the big hospital to the area that the mother stay, and we call the sub-district health facility. They have nurses and public health staff and some village volunteer, health volunteer to come and visit the mother at their home for 3 times after delivery to close the gap between the hospital and the mother. And also about the here, let me move to here, the maternity leave. In Thailand, we have only 98 days 98 days of paid maternity leave. But let me give you the information about this. For the first 45 days, the employer compensates 100% of their salary for the first 25 days. But the second half, the Social Security will compensate their salary with the ceiling. So many mothers who are concerned about their income, they come back to their work before 3 months. Even though they have 98 days of paid leave, but it's not 100% compensation. So the second half, where they have the ceiling of compensation from the Social Security, which around $500 a month. So maybe it's not enough for them, so they have to come back to work. But for the public sector, the government officer, they do have 100% compensation for 3 months. And for paternity leave as well, the paternity leave right now is enforced only for the public sector, but for the private sector, the father do not get paternity leave. Fortunately, now we have the draft new law in the senator level. They're considering about increase the maternity leave from 98 days to 120 days, and will implement 15 days of paternity leave for nationwide. And in Thailand, also now moved from the Code of Conduct to the Law of Marketing Infant and Young Childhood Act. This law has been implemented for several years, and this gives the authority for Ministry of Public Health to enforce if any violation occur. They can enforce with this. So it's more stronger than just a code of conduct. I'm not sure whether in Indonesia they have a law or the code of conduct about meal substitute. Yes. Okay. Thank you. And this is the challenges that I think we do still have in Thailand. That's why we cannot achieve the target of 50% of exclusively breastfeeding. First of all, we have the limitation for integration breastfeeding into the curriculum for medical students. Actually, we do have written in the curriculum, they teach knowledge, but for practical, they lack of hand-on practical skills. So this remains, and we have no specialty who is the leader in breastfeeding. Like some hospital obstetrician lead in breastfeeding, but some hospital pediatrician lead the breastfeeding. So we have no one who being the leader in this. We have no breastfeeding medicine residency training in Thailand. Any other country have breastfeeding training, like a residency training in your country? Okay, so and also for continuing education for healthcare professional, physician and nurse, we do need to have the mentorship or breastfeeding support for them. So I'm impressed by your program that you build up the counselor in Indonesia, like Dr. Arita mentioned before. And also the service, the quality, as I mentioned, we do have the breastfeeding clinic in every provinces in Thailand, but the quality one, some mother needs to travel quite far. Like I sometimes had the mother come from 5-hour drive to get into my service to get the consultation about breastfeeding, because we still lack of the quality breastfeeding clinic one. And for the communication with the community, nowadays our communication is more focused on awareness, which is not a problem. But the practical point that the mother can do the breastfeeding, we have the problem with the mother that who got competitive in doing the breast pump. They usually compare themselves with others that maybe have to have the 100 bag of express milk in the freezer. And that's a problem because too much oversupply of the breast milk can cause a blocked milk that can cause stomatitis, can cause breast abscess, usually need to correct the understanding of the mother because they do not understand that they need to empty their breast. That's what they're thinking. They need to empty their breast and they try to express their milk more often to prevent mastitis, but that's not the truth. So this is my final slide. I'd like to end with this. Breastfeeding is a long journey. For mother to reach their destination, I think we need to have the skills guide, like doctor, nurses, or healthcare professional who have a skill to teach, to solve the mother problem, and they do have a good and correct true and math. Like when mother have the problem in breastfeeding, or they would like to get more information or accurate knowledge. Now in Thailand we lack of the accurate book or accurate information for mother and healthcare professional. And finally, a timely support is very important. When the mother had the problem with breastfeeding, even 1 day of delay support treatment may reduce their confidence. So with this element, if we can achieve, I think we can move from the policy to practice. Breastfeeding gonna be the norm in Thailand rather than the aspiration right now. Okay, thank you.
Thank you very much, Dr. Kang, for your sharing about the Thailand policies on breastfeeding. Although you mentioned that the rates of exclusive breastfeeding in Thailand is still lower than Indonesia, but you have 28%, but it's already like showing like an increase, a good progress now. And also actually in Thailand, because you have actually the longer paid paternity leave. You have like 15 days of paid paternity leave. But in Indonesia, we only have 2 days of paid paternity leave, and you can extend it to 3 days if your employer agree on that. So it's really short. So the husband can only accompany the wife during the childbirth, and after that, okay, go back to work. And yeah, your wife gonna take care of your kids at home and dealing with the breastfeeding alone at home. So that's the policy of Indonesia. So you make the policies actually already supportive for the fathers as well, for the in supporting the breastfeeding for the mother.